We received magnet recognition in September of 2015. We received a call that was a glorious day for the entire organization. And really, Magnet is about validating our excellence. In September, we received the call of my life, for sure, my career, when the Magnet Commission chair called.
The result, it is my honor to officially notify you that the Commission on Magnet unanimously voted to credential Medical University of South Carolina as a Magnet organization.
When that call came through, there was just an eruption of clapping and cheering because this is really where we wanted to be, and it was a celebration and a validation of the excellence that we knew was evident in our organization. A Magnet organization is really a gold seal of approval for patients. And so patients that choose a Magnet organization for their health care know already that they have a higher level of excellence in quality care, a higher level of engagement in staff. Being a Magnet organization is such a great thing. We are one of only 7% of organizations worldwide that have this designation. So it's really, really important. And for nurses, it's really a validation of their excellence. We started our journey for Magnet in about 2002. I set the vision way back in 2002, and we began on that journey. And in 2006, after a discussion between the then CEO, Stuart Smith, and myself, we decided to really build a firm foundation for the entire organization first before submitting our application. And that's when we started on our MUSC excellence journey and began to adopt the principles of some of the Studer principles. And once we had that firm foundation, then we restarted our journey in 2011. And that started with me hiring Andrea Coyle, who is the Professional Excellence Director.
While I stepped into my role in 2012, there was a lot of work that went on behind the scenes in preparation. In 2012, the first order of business was to conduct a gap analysis to assess MUSC's readiness for Magnet designation. After completing the gap analysis, what we did was we had to create some infrastructure. We had to develop some processes and also establish measurable outcomes to be successful on our Magnet journey. One of the first things we did after the ANCC consultants made recommendations was to relook at our shared governance. We actually conducted another gap analysis for our shared governance and identified some areas that we needed to strengthen. In fact, in January of 2016, we recently rolled out unit-based shared governance in the inpatient unit areas to give our nurses an opportunity to create change, whether it's policies, procedures, practice, and of course everything we do is always based on comprehensive evidence review.
Shared governance is really giving the nurses a structure for where they can bring their concerns, opportunities at the unit level and at the organization level, and where nurses can drive changes.
So we've held our first two shared governance meetings in January and February. The response has been enthusiastic, energizing, overwhelmingly very positive response. The evolution of our shared governance is going to take us into our redesignation, which is in 2019. And the value of a shared governance structure is that, again, nurses continue to strive for excellence. We look for quality improvements, practice change and improvements, and that will all be fostered by the work of our shared governance councils.
Magnet is really a journey that never ends.